Hello and welcome to the 2020 Education Minnesota ESI Member Benefits Medicare Made Easy webinar. My name is Sandra Jutton and I am an account executive at Minnesota Health Insurance Network. Today we're going to discuss who is Minnesota Health Insurance Network and some of the fundamentals of Medicare. So we are an independent agency with over 25 years of experience in the health insurance industry. We do help represent all of the major healthcare providers in the state of Minnesota, as well as priding ourselves on helping seniors shop to better understand their options with Medicare and how to supplement that coverage. We also offer exclusive group Medicare benefits to Education Minnesota members. Below are just some of those major companies that we help represent. So let's talk some of the Medicare fundamentals. As you can see here, this is a sample of what your Medicare ID card will look like. It will have your name, a generated Medicare ID number, as well as showing when you are eligible for Medicare Part A and Part B. So what is Medicare? Medicare is a government program developed for the nation's aged to provide financial benefits for health-related occurrences. There is a range of Medicare's medical services, which will be your hospital stays, physician visits, some prescription drugs, and many other services. So how do you qualify for Medicare? The most common one is going to be turning 65. There are also some other ways, which is becoming permanently disabled or being diagnosed with end-stage renal disease, also known as kidney failure. So how is Medicare divided? The first part is Part A, which is your hospital coverage. There is a deductible for every time you are hospitalized, so per benefit period. Our second part is Part B, so that's going to be your outpatient services or your medical coverage. There will be a monthly premium as well as co-insurance. You'll commonly hear this referenced as Original Medicare. Now where we help is going to be that Part C, so there are Medicare Advantage plans, as well as your Part D, which is the prescription drug coverage. So how do you pay for Medicare? So Medicare Part A will have a $0 monthly premium, as long as you've contributed your 40 quarters to Social Security. That's the equivalent of 10 years. If you have not, but your spouse has, you are eligible to have Part A at a $0 monthly premium. Part B will have a premium of $135.50 for 2019. Now this is a standard monthly premium and it can be influenced whether or not you have a higher income. This premium also is subject to change per calendar year. If you're collecting Social Security, that'll be a monthly deduction right from your benefit check. If you're not collecting, that's going to be a quarterly bill that you receive from Social Security. As well as Part C and Part D have optional premiums based on the level of coverage that you want for yourself. So let's talk some of those enrollment periods. The first one's going to be your initial enrollment period. So this is for folks turning 65. This is that 7-month window for newly eligible beneficiaries. So this is going to be 3 months before your birth month, and 3 months after. Enrollment can be done through the Social Security Administration. However, if you are collecting Social Security, that will be an automatic enrollment into Part A and Part B the first of your birth month. Another major enrollment period is going to be the annual election period. This takes place in the fall and starts on October 15th and runs through December 7th. This gives you the opportunity to switch for alternative coverage for the next calendar year. And then our other one is going to be that special election period. So this is allowing for special circumstance. So if you're someone who is over 65 and you're now retiring, you'll have what's called that special enrollment period to look at Medicare supplement plans. However, you actually can enroll into an Education Minnesota sponsored group plan at any time. So let's talk what some Medicare plan types are. You're going to hear the term Medicare supplement. That also can be referenced as a Medigap plan, so you will hear both. Now to the side here, these are the plans that are available in the state of Minnesota. So not all of the plans are going to be the same state to state. So these are the ones that you have as an option to you. In order to have a supplement plan, you have to be enrolled in Medicare Parts A and B. In general, you can typically see any provider that accepts Medicare payment, so you don't have to worry about using a network. Should you move, that coverage is transferable to other states, so you're able to take that with you. And these plans will not include drug coverage. Another plan type you'll hear is the cost plan. So these plans can kind of be viewed as a hybrid between supplement and advantage plan. So Medicare is the primary payer for A, and the cost plan is going to be that primary payer for Part B. These plans, you are able to coordinate payment with Medicare, and they do give you the option to do that cost plan with Part D, or you can shop around and seek a standalone drug plan. Not all cost plans will offer that drug coverage benefit, though. These are available only in 21 counties in the state of Minnesota, so these are going to be the outskirts, the very south and north regions. The last plan you'll hear us talk about is going to be Medicare Advantage plans. So these plans are going to be plans that combine Part A, Part B, and going to give you additional benefits, and they will include Part D typically. They are going to use a network, so it's always recommended to see providers in that network. Should you go out of network, there's typically a higher cost sharing. And the travel benefits will vary between carrier. Next, we're going to talk about Medicare Part D, your drug coverage. You'll hear the term coverage gap. That will also be referenced as the donut hole. There are a few different stages here with Part D. That first stage is when you, the insured, have paid your deductible, any co-pays for your prescriptions, until you've hit a total cost of $4,020. Should you reach that, you're going to enter what's called that donut hole. So when you're in the donut hole, you're paying a higher percentage for the cost of your drugs. You are able to exit that donut hole if you have now hit a total cost of $6,350. That's referenced as catastrophic coverage. Costs in your coverage gap will be 25% for all generics and brand names. So should you reach that $6,350, you're now going to have a better copay or coinsurance, whichever is greater, for the cost of your brands and generics. So what to look for in your Medicare plan? You always want to make sure that you're looking at that out-of-pocket cost. What is going to be the total you'd be vulnerable to should you have a bad calendar year, as well as the formulary, making sure that your prescriptions are covered at a decent cost and covered. Networks and accessibility are also important, so making sure that you do have that ability to go to your doctors. Are there any specialists that you need to continue seeing, as well as hospitals and pharmacies that are important to you. And security and trust with a brand, that's also important, making sure that they're reliable and dependable. And the communication is also a huge one as well. So the customer service, are they friendly? Are they, giving you proper time response, to any sort of problems that could have arose with your insurance? So here we have a couple different resources if you do have any additional questions. So here's the Centers for Medicare and Medicaid Services and their number, as well as your Social Security Administration office. Now this is the national number here. You always are encouraged to go to your local office for Social Security if you do have any questions. And then my information is listed below. So should you have any questions about any of these slides, you can certainly call and I can help you with those. Now we'll just take this time for any sort of questions that anyone might have, and I appreciate your time and patience with me today. Thank you.